Zimbabwe is among 16 countries that are set to conduct a scientific survey to determine the extent to which COVID-19 has been spread across its locality. Spearheaded by the Ministry of Health and Child Care through the National Institute of Health Research, NIHR, the research would inform the national response strategy, in particular, formulation of relevant policies regarding the pandemic.
So for the seroprevalence survey, we are happy that the designing has involved other researchers that are collaborating with the Ministry of Health through the National Institute of Health Research, and these include the World Health Organization, the Center for Disease Control, CDC Atlanta, and ICAP, Africa CDC, Higher Life Foundation, MARS, the University of Zimbabwe, Biomedical and Training Institute, the Medical Research Council of Zimbabwe, the National Blood Services Zimbabwe, as well as ZimStat. So all these institutions have come together to design the National Seroprevalence Survey protocol. We have submitted the protocol for ethical review so that when it is implemented, it can be, the results can be disseminated. I also want to indicate that the researchers had come up with the concept note to design this project, which is also one of the World Health Organization priority projects and CDC priority projects. It was concurrently noted by the Cabinet of Zimbabwe that the seroprevalence survey would better inform the country on the extent of the distribution of the disease or the spread of COVID-19 in the country. And hence the Cabinet requested that the survey be implemented in a short space of time in order to advise for policy formulation and the strategies. So, where we are now is at the stage of indicating to the Medical Research Council of Zimbabwe all the process that we are going to be doing. And methodological wise, the project is going to be implemented in all provinces and in all districts. In each district, there are sentinel sites. There are actually enumeration areas, that have been selected by ZimStat, which is an agency that is involved in the census, and they have the knowledge of the population distribution, and the selection of the enumeration areas has been done randomly. And the ZimStat has also been able to conduct the household listing, which is the information that is required by the researchers to be able to conduct the seroprevalence survey. We do have an estimated sample size or the study population of 7,225 that will be involved in the survey. We also have included the spectrum of people to be studied or to be involved in this study. They include children from the age of 2 to the adults reaching the age of 100 years. As part of the field data collection, we are going to conduct laboratory tests that are going to be done on spot using the rapid diagnostic kits for the diagnosis of SARS-CoV-2 or detection of SARS-CoV-2 antibodies that are specific, including IgM and IgG. So the RDT has already been donated to Zimbabwe following our expression of the desire to implement the seroprevalence survey in the country. It has been donated by the Higher Life Foundation through Mars. And we have a donation of 8,000 kits. So we are able to cover our study population or our sample size, which is 7,225. The rapid diagnostic tests, they do not give us a confirmation of infection status of an individual with SARS-CoV-2, but they indicate the exposure of an individual when the antibodies are detected in the blood of an individual. It means that an individual has been exposed. For instance, IgM, it would be immediate exposure, or we are in the acute phase of infection. And then IgG, it is simply showing us that there has been an exposure which could be now past infection, because the antibodies, they remain, there's a protein that are made by our body in response to the presence of a foreign particle or a foreign body in our system. So they register, and then we have now a memory of the proteins which then are already in circulation, they are produced, and we can be now able to now say in this area we have so many people that are infected, that are showing antibody tests positivity, and it means that at some extent they have been infected, or they could be infected. There is an overlap between the virus, COVID-2 virus, and the existence of the antibodies in circulation. However, what begins in the circulation is the COVID-2 virus that triggers the mounting of the immune response, resulting in the presence of the antibodies. So we want also to be informed if we do have the herd immunity in the country. You might know that in Zimbabwe we had the first case of COVID-19 on the 20th of March 2020, and to date as we speak we've had 6,070 cases of COVID confirmed, and of these we have had 4,950 recoveries, and we now have 665 active infection, and 155 has actually succumbed to COVID-19. But what this would mean is if we are having these high numbers of recoveries, if we then can be able to tell if we have a large proportion of our population having been infected, then or having been exposed to infection, then simply it means then that we have the herd immunity, simply meaning that the disease could be with us in circulation in the community, people being infected, but it does not cause severe complications much. Unlike when we have it's just like a flu, like one of those flus that can take others to bed, and here and there some of the individuals with underlying conditions can be taken to bed and they can actually lie and rest. They can pass on. But what then it could mean if we have herd immunity, it means then we are protected now by the exposure to infection. And to what extent, that's what we want to establish. However, if we still have patchy distribution of the virus in the community, it also means that we have to all be much more vigilant, because we don't know how those areas that have not been exposed would then, or the communities that have not been exposed, would then react to the exposure. Would we continue to have high numbers of the cases that develop to complicated stage and also passing on? But we hope we are going to be able to tell if we have made a big number of asymptomatic cases in the country, and to us, if we have such high numbers of asymptomatic cases, then means that we have reached the herd immunity and we are sort of like protected, although we still have to be vigilant in the control of the disease. At the stage we are now, we have been able to ensure that all the required resources have been pledged in kind and monetarily. And the partners have done a great job. We are just in the process of finalizing their approval processes of the pledged support to the program. So that's where we are. We are very hopeful that the study will be implemented well, and we'll be able to come up with the results that will inform the community, that will inform the policymakers, that will inform the cabinet.